Okay.
Okay. Excellent. We're good.
All right. I am going to go ahead and introduce our speaker today. Louise Stoney is joining us today from Florida, actually, and is the co-founder of Opportunities Exchange. And I'm going to allow her to tell a little bit more about herself and the organization and begin the webinar. Welcome, Louise.
Welcome, everyone. And I'm actually going to begin my presentation by saying, whoops, hang on a second. Let me do this. Let me start sharing my screen. That will be the best way to start. Is that working? No, wait a minute. Sorry.
Oh,
Let me
it
see
was
if I
just
can-
coming up.
All right, hang on a second. Let's see if that works. No,
Yes,
but I
Well,
can't.
we see the next slide.
Okay, there. Do you see it now?
We still see where,
Okay,
but we
wait a
can
minute.
see the main slide.
Let me start again. Let me
All
try
right.
again. Okay. Now, is that working?
Perfect.
Okay, excellent. All right. Oops, let me go back. Sorry.
Yes.
All right.
You're fine.
So anyway, hello, my name is Louise Stoney. I'm co-founder of an organization called Opportunities Exchange. And our goal is to transform the business of early care and education so that programs can be sustainable, can be strong, can be high quality, so that children and families get the services that they need. We've been working with Early Childhood Iowa and the Department of Human Services for the past year on a whole strategy designed to reinvent the early care and education sector. And so I'm going to basically walk you through the underlying theory behind this work, and then talk very specifically about what we're doing in Iowa with ECI. Before I get started, I just want to full disclosure, as Chanel said, I am in Florida, and there is a hurricane about 100 miles off the coast that is heading straight for us. So it might be that I lose power in the middle of this presentation. And if I do, we will regroup and get a recording to you. But just want to make sure that if that happens, please know that's probably why. All right, let's get started. So I think there's a real tendency for all of us, especially now, to think that the problem with early care and education is COVID, and that we are good. I can't tell you, almost every day I hear, oh my gosh, what are we going to do when we fall off the cliff and we lose the stabilization money? And what I keep going back to say to people is, pause, wait a minute. Early care and education was broken before COVID. Then we poured a bunch of money over it. And if we aren't fixing the fundamental problems that caused this in the beginning, then we have not used that money wisely. So what I really want to talk to you about is work that we're doing in Iowa right now to think very strategically about how stabilization dollars are used so that we're addressing the fundamental problem. And I know I'm speaking to the choir here, so I don't need to really use this slide, but I wanted to show it to you just so you understand that when I speak to other groups that aren't early care and education practitioners, I often use this slide to just help them understand why early care and education is broken. I mean, basically, you have a lot of really hardworking, deeply committed small business owners that invested a lot of their own savings. And quite frankly, before COVID, they just couldn't generate enough revenue in those programs to make ends meet and to pay decent wages. So what is the fundamental problem? This is our slide for what we think are the real challenges. So if you look across the top, this is the formula for success. In order to have high quality early care and education, you need pedagogical leadership. And those are all the kinds of things that are in this box, right? You got to know about child development. If you're leading a center, you got to know how to be able to coach your teachers and supervise them in effective practice so that they really understand. You're going to have to do child assessments, all sorts of things to really support that teaching and learning in a deep and effective way. That is a whole body of knowledge that's extremely important and requires a lot of time and resources. Then there's business leadership, all those things that keep money coming in the door. You got to be full. You got to be collecting all your fees. You got to do all this reporting and all that stuff, regulatory requirements. These are really important jobs. And the sad truth of it is, in the United States, all too often, one person is responsible for that. And sometimes that one person is also the teacher or the chief cook and bottle washer, because our programs are so small, because our programs are so under-resourced. So we need to change that. And what I'm going to talk to you about today are 3 game changers that we're working with in Iowa, in Iowa right now, that we believe can have a dramatic impact on the field. And I'm going to walk you through all 3 of these in more detail. And we're going to start with automation and business support. So when folks talk about business leadership in early care and education, most typically the default is, oh, we need to do business training. Well, the sad truth is business training doesn't work very well. And one of the reasons it doesn't work very well is, first of all, you've got directors that are overwhelmed. I mean, can they find time in the day to go to another training? Or even if they show up, can they find brain power to even hold that information, right? And then the other thing that's super interesting is what we've actually done a lot of research at Opportunities Exchange. We really think a lot about how do we get results, and if something's not working, why isn't it working? And so I really was Googling a lot about training, and I came across this research on something called the forgetting curve. And that's what these data that you see on this slide are from. Do you know it is scientifically proven that in 1 week, 90% of what someone hears in a one and done workshop is forgotten? That's really sad. And for those of us who want results, we're like, well, wait a minute, how do we change that? Well, what we know is the way to change it is to help people put into practice right away what they learn. And in business, what this means is giving them an automated childcare management system that actually helps them get all their records organized, put things in place, create systems. So really giving them concrete tools and helping them on board, use that tool, start making sense out of all the paper that they have in their system and all their reporting. And then once you have their data in, start running reports from the tool. Oh, now here's my accounts aging. Now let's talk about bad debt. Oh, here's my enrollment. All right, let's look at enrollment trends over time. So you begin to build training with a director that is very responsive, that is based on their own data, and that is rooted in tools that actually help them to get the job done. So what we're learning is that this strategy works. And it works because we're helping directors to save time and to boost revenue at the same time as we're teaching them business principles. And all of this work on business management is really rooted in what we at Opportunities Exchange, we talk about the iron triangle of early care and education finance. These are the 3 most important data metrics that a child care program owner or director needs to be on track in order to be sustainable. You got to be full every day, every seat. You got to be collecting your fees in full and on time every day. And you have to understand your cost per child and make sure that your revenue is sufficient to cover that cost. And that means not just average cost across all your center, but cost by classroom, because we know that babies cost a lot more than toddlers, which cost a lot more than preschoolers. So you have to really understand that mix. It's a simple formula to explain. It's really hard to do. And what's cool about childcare management systems is that they are actually designed to support the iron triangle. They have a whole bunch of tools and reports and processes that actually make it easier for early childhood program leaders to track the iron triangle. Now, for those of you who are new to this term, childcare management systems, what we're talking there, these are by and large off-the-shelf products that are built for the early care and education sector. And brand, so, and right, and brand names, Bright Wheel, Pro Care, Smart Care, Playground. So these are all tools. Iowa is investing, and we'll talk a little bit more about this, about making some of these tools available to you for free of charge. But the bottom line is, if you're already using a child care management system, that you're already ahead of the game, and you can improve your use with that system, whether or not you choose one of the products that Iowa is making available. Now, I'm going to assume there are people in the audience who don't believe me. That's okay. I'm happy to try for people to not believe me, because I want to show you how I know it works. And this is data from a project that we worked with in Atlanta, Georgia. Full disclosure, this was before COVID, these data, these numbers. And this is a project that worked with a cohort of about 40 early care and education programs. Most of them were centers, but a few were family and child care homes. And this is the success they had in 1 year. So when this project began, the average bad debt was over $50,000 a program. And what I mean by bad debt is revenue that program could have been collecting that they were not collecting, either because they didn't have processes in place to make sure that parents paid their fees, or they weren't fully collecting money from government that they should have been collecting because they didn't have systems in place to reconcile what was owed with what they got paid, or they weren't doing the paperwork right. A lot of different reasons why people have bad debt. At the beginning, many programs were also not full. It's typical for programs to say they're full, but when your measure is every seat every day, lots of programs have vacancies. And almost none of the systems were really maximizing the benefits of automation. 11 months later, so less than a year later, they got that debt down to $877 a program. That's over $50,000 of more revenue for these programs. Enrollment went up. And again, sometimes enrollment is just even gaps between when seats are filled, right? Because you got a pipeline, you got systems in place to keep your slots full. And overall revenue increased by 24%. Now, for those of you who are working with or in a home-based childcare program or working with home-based childcare providers, I wanted to show you some data. This is not real data, by the way. This is hypothetical data. But I wanted you to just see what the difference makes in a home-based setting, because the iron triangle really matters a lot when you're really small. You wouldn't think it would, but so here you see a program where they're bringing in about $600 a month per child. So that means with 6 kids, that their annual revenue is about $43K, okay? But look at this. It's not at all uncommon for family childcare homes to have a vacancy rate of 25% or more, right? And look at the difference in revenue when you go from 25% vacancy to 5%. That's a big number. It's also not at all uncommon. In fact, 15% bad debt is pretty standard in family childcare homes. And honestly, we see bad debt in family childcare homes 35, 40, 50% sometimes. It's hard as a family childcare provider to look a mom in the eye and say, pay up, when you have a personal relationship with her, when you only have 6 kids. But look at how much a difference it makes in that revenue. So what's great about automated software is that it's not you looking the mom in the eye to collect the money. The system is automatically pulling the money out of their bank account from a debit card or a credit card. The system is automatically sending alerts. So it really takes away some of that personal relationship piece. So let's talk about what we're doing in Iowa and how all of this work relates. So we're working with Early Childhood Iowa and the Department of Health and Human Services on first of all, supporting business coaches. They're staffed by Mitsue, financial management coaches that will be working with early childhood programs, linked to the opportunity to get a free license to Bright Wheel or Playground. It will be your choice what you choose. And the coaching will be linked to use of that software. And then in the background, there's work going on to create a data bridge between between Bright Wheel and Playground and state subsidy billing. so that you won't have to do separate paperwork. You won't have to do separate sign-ons. When every family electronically checks in using the software, that will automatically pull information into DHS for subsidy billing. That's where we want to get to. That will take more time, but that's the plan. So that's the first piece of business, which is maximizing automation and business coaching. I just want to check, are there any questions on that before I move on to administrative scale? I'm not even looking at chat, but I see there's.
We don't have any in the chat right now.
Cool. All right. So now let me talk about administrative scale. Because yes, maximizing automation is super important. And it's actually the roads and bridges of getting to scale, right? The reality is that small sites just can't afford the skilled fiscal and administrative staff they need. So what we want to think about is not only maximizing automation and encouraging support of childcare management software, but also encouraging what we call shared services, which is how do we share staff and resources across small sites? So let's think about this for a minute. And I first want to stay on the issue of the power of technology to support scale. So this picture here is of the different functions of a childcare management software system, right? And these systems hold information for all of these things. And the goal is to make it easy for you as a program operator to have all these data at your fingertips. But if you think about it, a lot of the reporting that you need to do for government agencies and other funders is also in this system. Sadly, most of those other systems require paperwork, right? So many of you are spending lots of time filling out paper. However, when we get to the place where we start getting everyone using this technology and using it well, and documents are held in the cloud, then we can simultaneously work with government agencies to start accepting electronic documents. That's going to free up both resources and time on your end. I was just hearing from a director who was using a software tool and to the max. And she said that prior to using this tool and getting all of her documents in place and working with the government to accept electronic documentation, she had to pay a full-time staff person to track all this paperwork for her kids. And she said, when I started maximizing the use of technology, that I no longer needed that staff person. That was money I could use to raise the wages of my teachers, to improve the working conditions, to offer benefits and things like that. So the bottom line is technology is a pathway to scale. And now what gives that technology even stronger legs is linking it to shared services. So there are ways to wrap around support resources connected to that technology. And shared services is not like a cookie cutter approach. It's not like a standard set of services. It's very much based on what providers need and what's the right offering in that community or in that place. So what you see in front of you is a slide that shows a range of approaches, and it shows the depth to which they provide transformation from the perspective of the childcare program. So there are a lot of folks that are here in terms of sharing information, online tools and resources. There's no reason why programs have to reinvent the wheel, and each one of them have to develop forms and tools and processes. Those kinds of documents can be shared. And there are strategies and tools for sharing those resources across programs. That's being done a lot all across the United States. There are also programs that are starting to share networking and coaching, both in terms of the business coaches that I just talked about, but also things like education coordinators, substitute pools. So a variety of ways that you can start supporting networking. Then you can move into back office supports. There are alliances across the country that have, and these are independent centers, by the way, that are all sharing a back office, an entity that will help manage their billing, their fee collection. And again, when you're using an automated system, this becomes a lot easier. And so that's another strategy that we're seeing a lot of growth in. And then finally, we're seeing lots of folks work on the deeper issue, which is really the fundamental issue that everyone is struggling with, which is staffing. And so basically helping programs to share share access to a healthcare navigator, and to create health benefit pools, retirement plans, to work on processes for paid planning time, to strengthen their capacity to boost compensation for staff. So there's a step recruitment and retention and HR and onboarding and screening of staff. Lots of really exciting work happening in that area, which is probably the most transformational work that we're seeing happening. So to give you another picture of what shared services is and what it looks like, basically, it's about finding a network hub, an entity that is willing to support a whole host of services on behalf of a network of programs. Some shared service alliances are only centers. Some shared service alliances are only homes. Some are a mix of centers and homes. The fundamental issue is that the network hub is designed to boost the power of their participating sites. It's as if they're sort of getting in the boat with them and rowing alongside. How can I help you scale a service so that you can get that job done faster, better, and at a lower price point, so that you can focus on what really matters, which is children and families? So what I said to you before is that I'm used to people not believing me. So I want to show you tell you a real story and show you some real data. This is data from a small faith-based program that wanted to change. And so this shows you the change they were able to make happen in 1 year. So when they decided to work with this project, their goal was to boost staff wages and for the director to get out from under a lot of the administrative work. And one of the first things that this shared service alliance did was to sit down with that center and take a look at their personnel budget. So you want to boost wages. What percentage of your personnel budget is actually going into classroom wages? And when they ran their personnel budget numbers, this is what it looked like. 48% of their money was going into classroom teachers, their personnel budget. 35% was going into administration, and 17% was going into non-classroom supports. That might be things like a cook, a bus driver, if they had a social worker. So that's what it looked like when they started the project. Within 1 year, they were able to boost the amount of money that they were spending on teacher wages to 62%. They shrunk admin to 24% and non-classroom supports to 14%. Now, I want to be clear, at the same time as this transition happened, not only were they able to shift how they spent the money, their total revenue went up as well. So let's talk about what they did and what the result was. So the change was they joined a shared service alliance. That shared service alliance helped them to fully implement an automated childcare management software system. That shared service alliance had a back office, so they were able to leverage the business expertise from that back office. And that meant they could streamline their site-based admin staff. They didn't need a bookkeeper anymore. They were getting those services from the shared service alliance. They didn't need a receptionist anymore. Families were checking in through their phones or through a kiosk. They didn't have to have someone standing at the door to make sure they signed or they checked in multiple places for multiple funding streams. A number of other things like that they streamlined. The other important thing is this, that center made boosting teacher wages and job embedded coaching a priority. So they said, whatever money we save, whatever revenue we generate from this process, we're going to reinvest it back in our teachers. So here was the result. They were able to improve teacher compensation. They gave wage increases to their classroom teachers. Everyone got access to health insurance, and their full-time employees got a 401k. And for this director, the biggest win was this one down here. That director had 17 more hours a week to spend with teachers in classrooms. That made that director super happy, because she had gotten this job because she wanted to lead teaching and learning. She wanted to be a child development expert, not someone who was stuck in her office all day dealing with paperwork and trying to manage budgets. So it was a real transformation for that center. And I want you to sort of see that 360 view so you understand that this change has to happen at lots of different levels, and it's a process. All right. Yeah, go ahead.
Okay. So I have basically a couple of questions, but one is kind of at some point, and I think it might be later in the slide deck, but the concern is raised regarding financial advisors that are not accountants. So you might talk a little bit about that and the differentiation between that, like the financial management consultant and some type of an accountant. And then the other question is, or the topic, I guess, is considering Procare as kind of a list of available software in the future, and or anything about, because Procare, because they do accounts payable and payroll modules. So just kind of thinking that through.
Yep, sure. Okay.
Thank you.
So I'm going to take this two separately. And let's first talk about that's a really interesting question about the difference between a financial management coach and an accountant. And I just want to say both of those jobs are important, and both of those jobs are different. An accountant knows absolutely how to handle accounting from the perspective of general accounting principles, what you might need to do for tax purposes, all of those things. An accountant is not going to know how to run an early childhood program. An accountant is not going to understand the iron triangle. An accountant is not going to understand all of the details around, wait a minute, I've got all this enrollment paperwork, and how do I make sure that that enrollment paperwork gets done properly, and this child is in my system, and I can track data so I can look at those key metrics, right? There are administrative and management functions that are key to running an early childhood program. And what we have learned in the School of Hard Knocks, and I just want to underscore that almost everything we've learned that really matters at Opportunities Exchange, we've learned in the School of Hard Knocks. And what we've learned is that the best financial management coaches are people who were former leaders in early childhood programs and lived day in and day out with those daily challenges, and learned how to use childcare management software effectively to solve problems. So those are two very different functions, and they're both important, but they're really different. So, and by the end of this presentation, I hope you'll understand, because more is coming, about how those two come together, but we believe that you need both. You need an accountant, and you also need a strong financial management office, which is really financial / administrative management. So I hope that helps with that one. Now let me go to the Procare issue. So let me go back and say that Opportunities Exchange is completely agnostic. I'm going to go back to the technology. Here we go. Opportunities Exchange is completely agnostic as to which childcare management software a provider uses. So there are and the honest truth is the technology field is changing rapidly. And I can't tell you, almost every week we are learning about new software companies building new things and expanding what they do. So Procare is the oldest software company in the business around childcare. They've been in the business for years. Absolutely, they are a strong competitor, and they have a lot of helpful modules, but so do many other software vendors. And in fact, there are software vendors that are excelling and going far beyond what Procare can currently do. So when Iowa made a decision to invest in childcare management software, There was an RFP process. There was a lot of time spent in identifying what are the things that we need as a state in order from a vendor in order to both meet the needs of providers in effectively running the program, as well as building the data bridges that we need as a state in order to streamline subsidy management and to pull data. And there was a very rigorous process. ProCare applied for that process. ProCare did not win the bid. The two software companies that did win the bid are absolutely doing not only what ProCare can do, but going further. So just know that, and I would encourage you to talk to these software vendors, to go look at them, to ask them, and also know that they are building out new functionality in some cases almost every week. So you should be able to find what you're looking for. I mean, the two things that you mentioned, Chanel, you might want to repeat them again, but I don't believe, I'm pretty sure that that functionality exists, or at least it will soon exist in Playground. I believe it already exists in Brightwheel, but do you want to say what the two things were?
It was accounts payable and payroll modules.
Yikes. Okay, I'm going by my memory, and I'm not sure that I would hate to speak out of school.
Right. And we can check on that. And no matter what, we'll keep this is just to help with communications and learning. And there are people here we can respond to it later and all that. So,
but we want to make sure that works for you. And my experience as part of this team that's been working with those two vendors is that we are asking this to be a two-way street. We're not saying, oh, just give us what you've already always had. It's like, work with us to make sure that your product is meeting the needs of the providers in Iowa. Okay, let me go on now. Unless there's something else, Chanel, I'm going to move on to my next. Oh, wait, where was I? Where did I end? I ended here. This is where I was.
Okay, thanks.
Okay, so where are we in terms of shared services now? So Iowa, so remember, we've talked about software, we've talked about business training, and now we've talked about shared services. So Iowa also put out an RFP to fund agencies that were interested in serving as shared services hubs. And they got two proposals, both of which were funded. One from 4C Community Coordinated Childcare, and one from Lutheran Services in Iowa. So right now, the shared services work in Iowa is small, and it's pilots, but it's promising. And on this slide are the services that those two agencies are going to be working on. So the 4Cs is proposing that they will serve both centers and homes in Johnson County. And you see the bullets. These are the list of things that they said in their proposal that they want to work on. Now, full disclosure, the RFP has just been awarded. The state is just now working on negotiating contracts with them. So all of this is very, very new. And we are just in the stage of, this is what they said they were going to do. So there's a lot more work to be done here. Lutheran Services is going to be focused on family childcare homes in the greater Des Moines and Sioux City regions. And again, you see the list of services here. So what I can tell you about the shared services work in Iowa right now is that it is nascent, it is new, there are some pilots, and our hope is that it will be a great testing ground for learning what's possible, and that over time it will grow. Okay. Now let me talk to you about the last game changer, which is real-time data. Because everything that I've been talking to you up to now is really rooted in data. And timely data matters. If we want early care and education programs to be sustainable, they've got to be able to track iron triangle metrics, enrollment, revenue collection, costs. And they've got to be able to track that data quickly in real time, not a month or two later. I happen to have a small business and I have an accountant, and when I wait for my accountant to send me reports, it's like 2 months later before I get that's not quick enough. We need systems that allow us to look at those metrics every week, maybe even every day in some cases. You also, when you're running an early childhood program, have tons of daily operation details that you've got to have reporting on. And you can't wait around for those reports, right? Attendance, meals served, quality compliance. And honestly, when you're collecting that data by paper, when you're pulling it together, not only are you spending a lot of time and paying staff, but you're also increasing your capacity for errors. Every time you have to write something down, you've increased the capacity that you're going to write the number backwards, or you're going to make some mistake. Here's what's amazing about technology and what's super cool. We can shift into a world where data is collected transactionally. And we really have started already to enter that world with COVID. And there's just so much possibility. So as most of you know, when COVID hit, many programs had to shift from paper check-in, from paper to touchless, electronic, right? So families are now checking in on their cell phones. Payment, parents aren't handing money, they're not writing checks, they're paying electronically, because that's what needed to happen in COVID, when we really had to work on contact-free systems. The huge opportunity for that is when you start making those transactions in the cloud, they're not only more accurate, they're not only faster, but it allows you to aggregate data and to then use data for smart decision-making in really awesome ways. So basically, what we're trying to do is to help providers be empowered by data and to use these data in ways that really help them to make smart decisions. We also want to empower policymakers to use this data so that the public money that they're spending in ways that make the most sense. And let me give you some concrete examples so you can get a better understanding of what I mean by this. So this is a picture from COVID, by the way, from Colorado. So this was a shared services alliance that was using a childcare management software called Alliance Core. And they were able to aggregate the data from all the programs that use this software and look at trend data over time. And what you see in this picture is they were seeing huge fluctuations in enrollment, in attendance, in their centers. Not so in their family childcare homes, which is kind of interesting. That was super important for them as they were leading and supporting these programs to better understand, what do we need to do to keep these programs solvent? And what's the message that we need to send to states? And what's cool about this is, this wasn't a survey that you had to send out to providers, are you full? This is real data based on real families checking in every day that you could aggregate at the press of a button anytime you needed it. Another example, this example comes from Texas, which stood up a real-time supply and demand system, again, during COVID. Now, interestingly enough, their system was not fully automated, linked to childcare management systems because they didn't have that capacity yet. I mean, yeah, they had some providers using CCMS, but they weren't all using it yet. And so what Texas did was to actually use text messaging. They had a program where they loaded all the data on actual enrollment. They spent the time to collect the data on actual enrollment and in all their early childhood programs by age of child, by site, all of that detail into a website that actually also was very interactive and allowed families to search for real slots, to reserve a slot online, to gather information from their program. So it was really like a childcare research and referral marketplace, but really maximized through the power of technology. And then they linked to that technology text messaging that went out to the programs every week saying, do you have any openings? Have your openings changed? So they could keep that data current. So I just want to show you what the result of that was so that you can see how powerful this kind of data can be. So what you see here, so the first part on the supply side, okay, this is not so new, right? They could tell you which centers were open, which centers in family childcare homes were open of the licensed programs in their community, in their state. Okay, no, this was actually by one county, I think. Anyway, that's not so new. You probably had that in Iowa. But now, look, we're starting to get to more new information. They also could tell you actual vacancies, available spaces by age of child. And again, this is aggregated data across the whole county. This is a very large county in Texas. But now let's go further and you'll see something even more cool. They were able to sort the data in that county by city. So this is by small jurisdiction, which is really where you had a better sense of where you need supply and where you might look at gaps. And again, they were able to sort data by age of child, by location. So they really had a sense of what does our supply look like? And they had these data, they could pull these data every week. It was live, it was up to date, it was real. Now, they also, what they did in Texas was they made subsidies available to emergency workers, right? For first responders. You remember when we were doing that. And what they did in Texas was that they administered that money through this website so that families went on this website, signed up. Yes, you got a subsidy. Now go search and you can actually reserve a space and enroll right online, right through this website, right? So it sent them from this website to the website so the providers had a page on that website. What that allowed them to do was to actually track how many families got the care they needed. And that's what you see on this demand side. So you see, this is kind of interesting, that 88% of the families that were looking for care either were actually already enrolled or had a pending placement. So that shows you that their supply and demand was pretty much in sync, right? And then for data geeks like me, this kind of data below it was really exciting because they could also tell you where did those families work. And that gives us a sense of where does the demand for childcare come from. So I'm showing you this picture because yes, this is a snapshot of what happened at one point in time through opportunities in COVID. But Texas is right now building out this system so that they can keep it maintained for over time. And there's a lot of changes that are happening to make that happen, to move from this pilot to a bigger system. But you see what's possible and how powerful this is. And if you think as an individual childcare provider, right? If you had access to this kind of data, let's say you're having trouble filling your preschool classroom, right? You could go online and see, well, wait a minute. Is this an anomaly? Or other early childhood programs in my community having trouble? If so, maybe I need to shift that classroom to be a toddler or preschool classroom, or maybe a after school, or maybe I need to think differently about how I operate my business. But it allows you to really get a much better sense of how you're doing in the context of your peers. And it also gives you a sense of where demand is coming from.
Hey, Louise.
Yes.
I'm gonna unmute Tammy Foley just to add something in, and then I'll kind of catch you up on some comments.
Sure. And I can actually, you want me to, I'll stop sharing for a minute so we can go back to this.
Okay.
Okay, go ahead. Sure. Oh, actually, it doesn't matter because you've got everybody. Never mind.
It's okay.
I'll go back to the
Okay.
screen. Okay, go ahead, Tammy.
Chanel, are you wanting to referring to the open API, or are you talking the connection with KinderTrack?
I just know you wanted to share. I'm sorry. Either item. I thought you were going to share both.
Sure. So
Tammy, I'm not hearing you.
Tammy, you got muted by mistake.
Yeah, you got muted.
all right, let's try this again. So there's been a lot of questions in the chat about ProCare and the connections with those data bridges to the childcare subsidy system in KinderTrack and that. And so in our plan, as we roll out these different projects, there also is that consideration of as Louise mentioned, there's quite a few companies out there that provide childcare management system software. And as part of our project map, one piece of that, and this will be down the road in our project, but is to create an open data bridge. So for those software companies that are not the state selected ones that were part of our process, so they're not, you're looking at something other than Playground and Brightwheel, the open API would be created and would allow those other software vendors to connect the data and connect it with those state systems such as KinderTrack, which holds our childcare subsidy data. That would be up to those software vendors to fund and make those enhancements in programming, but they would get those the required data elements and be able to program their systems from their side to be able to upload that data. It would need to be if you have ProCare, it would need to be a cloud-based software product and not one that just resides on like a desktop. So, that's something that has been part of our total project, but over the course of the next couple of years.
Great, thanks, Tammy. Yes, that is absolutely best practice, and that is where a number of states are going. Chanel, was there another question you wanted us to address?
I think that'll do right now. I'm gonna make sure we print off the questions because I think it'll help us for future communications.
Great.
Okay, thanks.
All right, let me just quickly, sorry, I apologize for folks who are, that's making you dizzy, but I just want to go back to all right. So basically, actually, I probably should have just gone straight to this slide now that I'm thinking about it, because Tammy was speaking to it. So the idea is to really work on data bridges, right? To strengthen the connections to childcare management software. And again, starting with 2 software companies that are willing to work with the state and to make it all work. But ultimately, the idea is to create what we call at Opportunities Exchange, an early care and education technology ecosystem that really has linked data across lots of sectors so that folks in early childhood aren't spending their time pushing paper. They're actually able to focus on kids, and that everyone has the data that they need to make really smart decisions. Because that's what we need in order to really reinvent the sector so that it can be strong and successful going forward. And I sort of want to summarize everything that I've really talked about, because there's a real theory of change here. We're thinking a lot about how things connect. So I've talked about these strategies, right, which the state is working on: business training and consultation, childcare management software, shared service alliances, data links, right? And then there are benchmarks that we're looking at from the perspective of childcare programs, as well as coaches and intermediaries that help us know whether or not we're succeeding, whether or not we're on the right track, and would allow us to do course corrections. And then ultimately the outcomes which we seek. We want people who work in early care and education to make a decent living. We want people who have own early childhood programs to make a decent living, to decrease the turnover, and to really strengthen your capacity to make smart, data-driven decisions. So that, in a nutshell, is where we're going. And actually, that's pretty much the end of my talk at this point. And if you want, Shannon, we could even just, I could stop screen sharing, and we could allow people to look at each other, and we could just ask, answer questions.
Thanks, Louise. So part of the chatting was really just just about ProCare. So at some point,
interesting.
we'll need to have something a little more specifically to some of the questions and items.
Yeah. Actually, and let me actually just say something that might be helpful to this group about ProCare. Opportunities Exchange does a lot of work with a lot of technology vendors. As I said, we are very neutral as to vendors. Our experience with ProCare is that right now, ProCare is most robust in its desktop application, because it is a legacy system. It's been around for a long time, back before the cloud was as robust, or we had even software as a service. Now the cloud is where it's at, and ProCare itself is having to do an awful lot of building to shift all of its power into the cloud, and it's not there yet. So for those of you who are using Procare, you may be frustrated. I mean, you're probably getting much more functionality if you're using desktop, but if you're using desktop, you're not going to be able to benefit from the data bridges. So there is a process that's going to have to go on internally with Procare and with its customers in terms of shifting all its functionality to the cloud. They do have a cloud version. You're right, Jay, but we have done detailed comparisons between what's in their cloud version and what's in their desktop version, and they do not have anywhere near the depth of functionality in their cloud-based version as they do in their desktop. We want their cloud-based version is great, but for providers who are used to using their desktop version, they're really loath to switch because there are functionalities there that aren't there. So they will get there. We're all going to support them. But I just wanted to state that as one of the challenges with Procare.
And I just want to share, you guys, we're going to keep working on this. And to Ms. Larson's question about another RFP, pretty much the way Tammy was describing it, once we get these things set up, we won't have to do the RFP. If Procare can do what it needs to do behind the scenes to make it happen, then that'll be open in the future. That's what Tammy was describing. And I just want to also just go back to Louise's first comment, and which I have been more and more amazed the more I learn, is how fast the technology is changing and growing, and understanding that it is happening within many vendors. So, and that's one of the reasons why we have Louise Stoney and her team helping us, because that's one of the things they are doing, is really observing and working through and helping us make sure we're getting as much information and the most current that we can. But that doesn't mean we'll still follow up with you all on some of these items as well as we can. And because our goal is to improve or do what we can to help your business side of your work. Okay, Louise, I'll see if there's any other questions, but if you have something else to address, we could do that. Otherwise,
well, Tammy just put something in the chat. Tammy, do you want to talk about what you mean by import? I think what Tammy's referring to is, and Tammy, edit me if I'm wrong, but Tammy's talking about import export functions. In other words, remember that when you have software as a service, you're basically, in a sense, leasing. It's like you're leasing that software. You still own your data. You can take your data and you can move it to another software system. So in other words, it's entirely possible to switch to a different software if that's what you choose. And there are strategies for making that easier for you. Again, we are not in the business of telling you what software to use. You need to pick what's best for your company. And we encourage you to look in depth at what that software is offering. Do not assume that you know, do not assume that if you saw it 6 months ago, it's the same software. It's not. We are shocked at how rapidly things are changing. So I just encourage you to investigate, to go watch the tutorials, talk to the software companies. There's also a company called Capterra that you can go online, and they actually, they have all sorts of customer ratings of different software. So you can go to Capterra and look at what are they saying about different childcare management software. That's another third-party impartial rating system of different software companies.
Louise, and you covered everything that I was going to mention. That's part of that.
Great. Anything else that folks have questions about or that I didn't cover?
I'm not seeing any other questions.
Okay. Well, I hope this was helpful. I'm sorry that we did it in a disembodied way. I would have loved to have seen all of you at the Iowa AEYC conference, but I don't know. The world has decided that hurricanes are keeping me in Florida. But luckily we didn't lose power, so I was able to finish
that's
this
right.
presentation. And for those of you, I'm going to actually share my screen one more time and just say that here, and I assume that that Chanel will make this PowerPoint available to all of you who want it, but you see our URL right down here, our website. There are a ton of resources about everything that I spoke about on that website. Feel free to go poke around. There's lots of things. Everything that we have is totally open source. You're welcome to download it, use it. Our goal is to really provide resources to help you do your job.
Louise, thank you so much.
All right.
We're going to, Amanda, I'm going to let you do it. I don't want to break anything. Go ahead and stop the recording. And